good afternoon to one and all present here. I, Ms. Arohi Fernandez, Assistant Professor, Parul Institute of Nursing, welcome you all to this webinar. The topic of this webinar is on the psychological facets of HIV/AIDS. We know that HIV is an endemic which the entire world is suffering from, and it has claimed more than 36 millions of lives. HIV has many kinds of disability and sign and symptomatology associated with it. And one of the main concepts, that is the psychological problems that a person with HIV or AIDS faces, is sometimes ignored from the mainstream symptomatology. So today we are here to discuss about the psychological aspects of HIV and AIDS. Now, I would like to introduce our resource person and speaker for today, Dr. Teresa Matthias Ma'am. Madam is the professor and HOD at Lakshmi Memorial College of Nursing, Mangalore. Madam completed her MSc from RAK College of Nursing in 1996. She has completed her PhD from Yenagoa University in 2015. Madam has also various certification courses. Madam has a vast experience of 27 years. She has numerous publications in international and national journals. Madam has guided more than 21 postgraduate theses and more than 10 undergraduate theses. She has been in various national and international conferences and has done the poster presentation and paper presentation in it. Madam has also been as a resource person in various platforms. She has organized and attended various kinds of conferences, workshops, and many more things. Madam is also the examiner of UG and PG examination bodies in RGUHS Bangalore, Goa University, Kannur University, MGR University, Tamil Nadu, Manipal University, and many more to go. Madam has been the panel member and also the examiner and assessor for PhD entrance and PhD work. We welcome you, ma'am, to this webinar. Now, I would like to request Madam to share with us some of the information from her plethora of knowledge with us today. Madam, you may please start with your session.
Good afternoon to all.
Good afternoon to all. It gives me immense pleasure. Is it resonating voice?
No, ma'am. It is audible and clear. You can go on.
Yeah. It is my immense pleasure to be a part of this program for the World AIDS Day on December 1st, even though we are having on December 2nd. At the outset, I would like to thank Arohi for introducing me to the audience. I also would like to thank the organizers for giving me an opportunity to be a part of this program. Today, I am going to focus my discussion only with the psychological concerns of people living with HIV/AIDS and how to overcome the psychological concerns. This topic is very vast because whenever we have a HIV patient, we have concerns in different areas. It can be physical, it can be psychological, it can be emotional, and it can be also interpersonal. But today, I'm going to focus on psychological concerns only. Now, as we know, the theme of the day's celebration is ending the HIV epidemic, equitable access, and everyone's voice. Now, everyone's voice can reduce the psychological concerns of people living with HIV/AIDS. Okay, to introduce my topic, all of us know HIV is a retrovirus, and this infects cells which are important for human response, that is especially immune response, especially the helper T cells. And what happens is, because of this, it leaves the host vulnerable to opportunistic infections. And so once a person is diagnosed with HIV, he he has sometimes recurrent infections. And because of this, let us see throughout our session what are the problems the person can have individually, to his family, as well as to the community. Now, lots has been discussed regarding when this HIV infection was discovered and many more things. But when it comes to psychological aspects, the first psychiatrist to address these issues was Stuart E. Nichols in his article Psychosomatic Disorders. So, in his article, he discussed how there can be issues, and from that time onwards, people have given importance to psychological aspects. Otherwise, before it was only the physical aspects or the symptomatology which was concerned. The psychological aspect was totally a neglected one. But today, when we look at the patients, it is as a whole. That is not only physical but psychological. And many of these studies, as we move forward, we will see that they have focused and evidence based practice is there saying that these are the various problems which occur for the patients. And because of that, neither they recover from the physiological problems or physical problems, but mental problems are more for this type of patients. Now, if you see the prevalence, it is estimated that India had approximately 1.2 lakh new HIV infections in 2009. And if you see the graph, it shows the trends from 2004 to 2009. And many of our states, if you see, Manipur has shown the highest estimate adult HIV prevalence. Andhra Pradesh there follows by Mizoram is there, Nagaland is there, Karnataka is there, and Maharashtra is there. And if you see the adult prevalence, it is about 0.25 percentage among women and 0.36 percentage among men, which was found in 2009. But now the recent trends is not available, but still there are many cases which are there, and there are people who are suffering with AIDS, but they have no ventilation for their feelings. I was going through an article which was published on NDTV, and the news article published says that there are people who have got HIV infections due to various reasons. Okay, there may be somebody who has gone with to some areas and they have got the HIV. But there was a person I have seen who has got HIV/AIDS after receiving number of blood transfusions. And we have also seen that there are women who get it from the men, and there are some men who get it from the women. So it can be vice versa. So here, people should know that students and the others should be aware that the adult prevalence is there, and we need to discuss it in light that there will be many psychological problems. Now, once a person is diagnosed with HIV positive, okay, or if he is tested positive, and we go and tell to the patient, you are HIV positive, or you have been diagnosed with HIV positive, okay, I'm very sure if you see what may be his reaction, immediately the person's reaction will change for himself. Oh, I'm a patient, I'm having AIDS, that is what is the thinking the person is having. Sometimes it may be a total surprise for him. Sometimes he might have was confirmation of what he has been suspected. For example, he knew that some problem is there with him, but it was not tested or it was not diagnosed. But then a diagnosis took place because they had sent a blood sample. And another important thing, what happens to the individual once he is known to have positive, is isolating and daunting moments. Then he tries to keep himself away. So once he keeps away, he doesn't interact with others, he doesn't share what are his problems, okay, and what are the difficulties he's having. So these are the various reactions what can be there. In my experience, I had a very unique experience with a patient. A patient was brought to the hospital and he had severe pain abdomen, and later he was diagnosed with appendicitis. Since the condition was very acute, they thought that they will take the patient up for surgery within a day or so. And it happened a few years ago, and the doctor said, okay, he's suffering with pain, let us take him up for a surgery. And they have taken the patient up for surgery after 1 or 2 days. But they never thought that maybe this patient was having HIV. But his report came as HIV positive. But they had not luckily taken up the patient for surgery, because without investigations, they will not take up. So when the patient was, we were thinking how to approach and tell to the patient and his family members that he is positive. But to my surprise, when I went to tell the patient, I got a totally different picture from the patient. The patient was very casual. I was telling him, are you aware that you have any illness? Have you been tested any time? Still, he did not reply. Later, he told me, no issues, ma'am. You tell if you have something in your mind. Immediately, he told me, and I told him, we did one test and it turned out to be positive. And we said that it is an AIDS test. The doctors are also with us. So immediately he said, yeah, I'm aware of it, ma'am. So what? You see the casual attitude of the patient. So sometimes they may be surprised, sometimes they may be knowing, but they don't want to reveal to us. There are some people who will be totally shattered because they have got it and they are unaware and they don't know what may be the reason. So we can have different reactions of a HIV positive tested individual. Now, what is the first spontaneous reaction? The first spontaneous reaction is the grief and the loss. Okay, people feel and they start crying. Okay, they feel that something is lost in their body. That is the immediate reaction what they have. Sorry. And then because of this, the person may go into stages of grief. And mostly the person has denial or shock. Okay, the first thing is, if he is unaware, he will be telling that no, it cannot be me. Later on, the person may be angry. Why it is me? Why not others? And from where did I get? Those are all the questions the person will be asking. Later on, he may be thinking, is it my report or is it somebody else's report? So he tries to bargain. Later, the person goes into depression because he has to accept that it is positive. And finally, he comes to terms that it is positive. We had a patient in our ward, okay, wherein a lady was admitted. It's a female patient. When she came to the ward, okay, she was diagnosed already with HIV. And when we asked her, how did she get it? Okay, then she told us the story, okay, or her life incidents which has happened. Her husband had gone away from the house for almost 20 years. He was not there. And one fine day, he came. After coming back, they stayed for about 5 or 6 years together, and then she delivered a child. Okay. After the child was born, she happened to go because she was losing weight. And then when she happened to go to the hospital, she was tested HIV positive. And then later on, they screened the whole family. And they also came to know the husband is HIV positive. But now to this woman, she was very much depressed because she has 3 children to look after. And when they were giving her a talk and other things, she came to know it is not only she is at risk, but her child who is born also may be at risk. So finally, she accepted the condition and she started to cope with her situation, and she started to live with the children. By then, her husband became critically ill and he died with HIV positive. So what I want to say is, see, the initial response of an individual will be always denial. Okay, it's not me, it may be somebody else. Okay, then the person tries to bargain, he goes into depression, and then finally the person has to accept or feels that, yes, now I cannot do anything, let me see what can be done. So that is the stages of grief. Now, at times, persons also show emotional responses to testing HIV positive. If he was a very healthy person and suddenly he is tested positive, he can be in shock, he can be in disbelief, sometimes he may be panic. He is trying to think how it has come to him. So he will be in a panic stage. Also fear, because he doesn't know about HIV AIDS, he doesn't know the treatment, he doesn't know the other options which are available to him. What about his family? What will they say? So he doesn't know anything about it. Also, he has a guilt feeling. And what is the guilt feeling? The guilt feeling is it only for me or is it for my whole family? Or whether they will be having this infection or not. So the guilt feeling will be there. And, the person who had a number of blood transfusion, he shared his experience. He said, when the doctor told me, I was so surprised that I have HIV because my home people and my other family members, they were thinking that from where I could get HIV, because for them the only route was sexual transmission. They are only aware of that route, but they are not aware that I could get it from the blood transfusion. So that is the guilt feeling what he had. Despair, hopelessness, because he doesn't know how to come out of this situation and who will help him to come out of this situation. So it is a very hopelessness will be there. Definitely anger also will be there, and a feeling of numbness. Anything you tell him, it doesn't go to his mind, okay, or it doesn't affect him. Like he's numb. He doesn't show any reactions to anyone. Okay, sometimes all alone he sits by himself. He thinks, he cries. So he's like numb. Okay, no reaction for any of the things, whatever is told to him. Now, what are the major psychological issues which are related to HIV? The most important thing is acceptance of the illness. Now, if there is acceptance by the individual regarding the illness, okay, it is easy for us to convince him for the treatment. If he is not able to accept and if he is not willing to come to the hospital for the treatment and for the follow up, then it becomes a difficult situation for the family, for the health professionals, and for everyone. So the first stage is the acceptance of illness. The psychological problem is in accepting the illness itself. So we have said already, we have shock. Okay, the person can be in disbelief. He's also anxious and he's not able to accept the situation that everyone knows that it is a HIV is a incurable disease according to the people. Okay, so they find it very difficult. Oh, you have HIV? Oh, it is not treatable. I mean, treatable in the sense you cannot do anything much more about it. So that type of feelings will be there. And because of this poor acceptance, it leads to disruption of the usual coping strategies. So the usual coping mechanisms will be very difficult for him. He cannot cope up with the present situation. He gets angry with the family members. He doesn't eat food. Okay, he doesn't mingle with others. He doesn't talk to others. So these are all the problems which can be there because he's finding it difficult to cope with the situation. And this leads to a guilty feeling to the effect on the family and the children. So the children and the family also support. You imagine if it is the breadwinner of the family and this is the situation in the house. Okay. So the wife and children will be also having a tough situation at home. And due to this, he will deny the social responsibility. He may not go for work. He may not respond to others. If they ask him, you are not feeling well, let us go to the hospital. He doesn't agree to go to the hospital. So these are all the problems which may be there for the persons. Even for follow-up, whenever the health professionals call him or whether he has to attend to any of the meetings of the HIV, he will not feel happy to be a part of the intervention program. So acceptance of the illness is one of the most important and the most difficult psychological aspects which patients have, to believe that he has the illness. Now, why there is difficulty in accepting? Because we have a lot of misconceptions regarding HIV. And one of the major things what people usually ask is, were you a drug user? Did you get it because you were a drug user? Are you gay? Do you have multiple partners? It may be a punishment from God for you, and you need to get this disease. You deserve to get this disease, or you may be a prostitute. So always people associate the problems because of this, where the person has got HIV. So these are all the misconceptions which are there, and so that is the reason why the person finds it difficult to accept the situation, because even if he reveals his part of the story, it's very difficult to accept for him as well as for the others. Okay, second is disclosure. Now, this is very difficult area for all the infected HIV/AIDS patients, because they need time to first deal with their own emotions. They take a lot of time to discuss with their emotions, okay, to come to terms with the emotions. They keep crying, they don't eat food, they don't mingle with others. So their emotions, sometimes they get angry, they insult others. So they find it difficult once they are diagnosed with HIV. This is another second problem which can have a lot of impact, psychological impact on the individual. And these are all because of the fears and the stigma. We come to the next point, that will be stigma. Okay, stigma and discrimination. In our society, even though lots of research, lots of treatment modalities are available, still there is a lot of stigma and discrimination associated with HIV positive patients. So what happens? The traditional families and the communities, okay, reject the person. Outright, he will be put out of the house if they are diagnosed with HIV positive. Even till today, people are having very poor information regarding HIV. So they require more of a social support from their family. That is what is lacking in our society. So the third one is stigma and discrimination. See, the person is very much silent because he is tested positive. And because of that, it is because he is ignorant about the testing modalities, about the treatment, about the modes of transmission, all those things. And because of this ignorance, he'll be very much afraid or fearful. And this leads to stigma. And stigma also can lead to discrimination. So whenever they are discriminated, okay, they feel that they are lonely, they are isolated, okay, they don't like to mingle with others, so they are kept aloof from all the family members. And usually they are taunted by the family members. See, you are the person, you have spoiled the name of our family. These are the common comments which we hear from the patient side. Also, there can be labeling, there can be stereotype, there can be division, okay, that is we and you. That type of discrimination will be there, and lose social status, and finally they'll be discriminated. So whenever there is discrimination and stigma attached to any of the illness, and especially HIV, okay, the person goes or withdraws himself into his own problems, and he doesn't like to share. Usually what we say is mental catharsis, okay, that is sharing his views, so, or what he has the difficulties. So sharing makes it very possible to know what are the difficulties the person goes through, and it becomes easy for us also to understand his viewpoint. So stigma and discrimination is a most important psychological problem which the patient faces. Now, what are the different forms of stigma and discrimination we often see in our communities? Now, we have got three types. The first one is self-stigma. That is, it occurs through self-blame and self-depreciation. Okay, the individual puts himself down. Okay, he goes on blaming himself. He doesn't blame anyone, but he keeps blaming himself, and he is always a pessimist. Like, he puts himself down, and he always, no appreciation, always puts himself down. The second one is perceived stigma, related to the fear that individuals have, and if they disclose that they have HIV. So what do? Even they don't know they are positive, they will not reveal to anyone else, because they feel that if I reveal to somebody else, okay, I may have stigma, or they may, they may not talk to me. There are people who have expressed to me saying that, Madam, once I was diagnosed with HIV, I was completely segregated from all of my home people. They did as if I'm an outcast, in the sense they are not mingling with him for any matter. And the third one is enacted. It occurs when individuals are actively discriminated against because of their HIV status. So these are the three ways by which the family members and the individual himself, okay, starts discriminating himself and puts himself down, that is, depreciates himself. Okay. The first common one is abandonment by their families and are forced to live in destitution. Okay, so once the family members try to disown them, what do? Where is the option for them? Okay, sometimes they go to their family members, okay, who are distantly related. They stay there. Once they come to know, they will not keep them along with them. Okay, then finally the person has no place to go. Okay, once okay, he may go to the hospital. Once he goes to the hospital, once he is discharged, we do not know what will be the next step for him. So he is totally abandoned by his family members. Secondly, inadequate family and community support. We have NGOs these days who are working round the clock for the HIV patients. Okay, but that is not enough. Still, there are many patients who feel that they have inadequate family as well as community support, and because of this, they go into poor drug adherence. They are supposed to be on the medications, but they don't take the medications as prescribed, because there is no family support and there is no support from the community. Third is, they don't want to disclose to anyone of their disease status. Yeah, few people will be knowing that he may be positive, but to others, he doesn't want to share anything regarding the illness. Now, if the workplace comes to know that he is HIV positive, what is the reaction of the boss and what is the reaction of the management? The immediate tendency for the people is they lose the employment, because employers think that they will not be productive and this makes them to lose their income. So also they miss their job. Okay, so once they are in the hospital for a long time, they get treated, they come back. Okay, then they think to themselves, what is the next option for their living? Okay, so they think that what can be done next. If they go and ask a job, I'm very sure the boss will not agree again for him to do the employment. So the productivity, he thinks that productivity may not be there from the usual work what he used to do. So this is another form of discrimination what he feels. The fourth one is what happens to the person after discrimination. The person goes into depression. Now, why does he go into depression? He goes into depression because of three reasons. One is, it is because of his infectious condition. The second is he suffers from psychosocial problems. And the third one is because of the medications, because he has to continue his medications. Now, because of the infections, there can be damage to the brain. Also, there can be psychosocial problems. And what are the psychosocial problems? He has chronic life stresses. There are various stresses which an individual can have. Okay, segregation from the family. Children do not look up to him as a father. Okay, they don't respect him. Wife doesn't bother for him, so he is left all alone. Moreover, there is stigma attached. Already we have discussed about it, and this leads to social isolation. And because of social isolation, he can go into depression. And also, the HIV medications and some of the addictive substances also can make him depressed. Sometimes we see when patients have to continue their medications for a long time, they are not for continuing the medications for a long time. They don't feel that they are comfortable. They have these side effects, that side effects, which makes them always depressed. So depression is another form of psychosocial problems which our HIV patients will have. And these are because of these three reasons. That is infectious condition, it can be due to psychosocial problems, and also it can be because of the medications, which is also exogenous. Now, the fifth problem, psychosocial problem, which that individual and his family goes through, is social and economic problems. Now, The main social and economic impact is loss of labor or education due to the illness. If it is, sometimes we have got young adults who are diagnosed with HIV. Okay, so and if they are a part of a studying program somewhere, so they may find it difficult to continue their program. And also because of the treatment, a lot of expenditure is involved, so they also have a problem. Sometimes they need to go and travel to a long place or a distant place for taking the medications, especially maybe if they have a government program and they are part of the government program, so they need to go to the travel to the this one. So all these uh, problems are due to the finance or due to the financial status of the patients, and because of that there can be social and economic problems. So loss of labor will be there, loss of education will be there, incur additional expenditure for healthcare as well as the transport. And due to all these reasons, okay, the person goes into poverty, food insecurity, as well as nutritional problems. So additional income goes for the treatment. So the family suffers from nutritional problems because they have no money to purchase the food for the family members. Yeah. The sixth one is there can be some of the psychiatric problems which can be there because of the HIV. Okay, and these are very, very severe in some families and for some patients, whereas for all it may be not there at the same level. So the first important one is the deteriorating relationship among the others or the family members, even the neighbors, even his own close friends. They may not keep any contact once he's diagnosed as HIV positive. So all the relationships, and he finds himself already aloof and alienated or isolated. The second one is he already has depression and there can be chances of committing the suicide. We have heard and it has been reported that few patients have committed suicide because of the depression following the HIV. And this is because of the shame and the grief of the loved ones. Sometimes, family members, they say, because of you, we cannot move out of the house. Say whenever we move out, they look at us in a different way. So the family is in shape. So what does the person feel? The person feels more and more depressed, and he thinks that if I end my life, I think the problems will be over. So that is the reason why the patient commits suicide. Another common one is anger and agitation by the patient. Also, the patient may be anxious or anxiety disorders may be there. And to forget is all these problems, the person can get addicted to other substance abuse, especially okay, alcohol or maybe other psychoactive substances, because he wants to forget all the problems which are there for the family and for himself. And studies have also reported that AIDS dementia, okay, because it affects the brain, that can be also possible for patients with psychological problems. So AIDS dementia is also present. Now, once the person is diagnosed, okay, he has the psychological problems. What is the effect on the individual or the HIV patient? He has the problem of fear or disclosure. Always he thinks, who will come to know about the information that I am positive? Even when he talks to somebody else, he may be suspicious in his mind whether the other person is aware that he is having this problem. Secondly, he may be having non compliance. Here and there, he will stop the medications because he thinks that it is no use continuing the medication. So, that may be the effect on the individual. Third one, we have lots of services which are available free of cost for the patients, but they are not utilized by the patients. We have NGOs, we have government hospitals wherein all the drugs and other things are antivirals are free for the patients. Okay, but the patient will not utilize these services which are available. And the patient has every chances of getting infection because he doesn't take the medications regularly. Poor adherence or poor compliance to the medications is there. So he can have super added or opportunistic infections. And sometimes they also feel and they also think that the healthcare workers also have a negative attitude towards them. Oh, he's a HIV patient, Okay, so they don't like me. I'm an HIV patient, and so they don't like me. So because of all these things, the person finds it very difficult to adjust to the situation. And so this is the effect because of the psychological problems. Now, more problems comes to the women. That is, studies have also shown that the effect on HIV women is more, because though he is a man, okay, people think that okay, he's getting HIV is somewhat okay, but when a woman gets, okay, people have a different attitude towards the women. Women are badly treated and frequently being blamed by their in-laws, even if they get it from their son. But the in-laws feel that, yeah, you have got HIV positive, and also others in the family, and the root cause is the daughter-in-law. So what did they do? On the contrary, most of these women have themselves been infected by their husbands, and so because of this, women are looked down by the family members. But if the male is having, they never look down to that extent. But when it comes to the women may be sometimes thrown out of the family. Okay, studies have shown that women have the impact on the women is that they have been thrown out by the family members because she's positive. Okay, and she cannot be looking after the children. Now, how do we intervene with such patients who have got psychological problems, okay, or those who have psychological problems? Many of the patients have, they do not tell us that they have psychological problems, but overall, since we know there is a lot of stigma and discrimination, okay, we think that we should need to give them some of the tips how to overcome the psychological problems. As we go towards some of the NGOs, here also in Mangalore, we have some of the associations for them. We have some of the organizations for the AIDS patients. Even every year, we send our students for a visit because they interact with those patients, and they come to know what is their life. Okay, so when we go there, we need to give them how to handle the psychological problems. Of course, the physical problems are always discussed in details, but when it comes to the psychological problems, hardly anyone gives much of the intervention. So these are some of the few interventions, okay, which will help them to live well in the society. So 10 keys to living well with HIV. Living well actually means the specific aspects or the steps you can take to maximize the health. Okay, these are the steps which we can give for the HIV patients so that they can maximize their health and how to keep themselves a quality life. The first one is, minimize stigma and discrimination. How to minimize the stigma and discrimination? The most important thing is stigma can be prevented by talking and acknowledging HIV as a major cause of illness and death. See, when they are living in a community, in a organization like HIV, okay, there may be chances of people dying there. And when they see people dying, okay, it is not easy to see somebody dying because they feel that when will be my turn, when will be the next turn. Okay, so here what we need to do is we need to speak to them and we need to give them the correct information regarding HIV. Also, they have a lot of queries and they have lots of concerns. Okay, they have lots of problems because of which they will not get sleep in the night. So we can give them counseling sessions. Okay, and there are counselors which help them to overcome their difficulties, day-to-day difficulties. Also, they have anxiety, which is a fear of the unknown, what will happen to them. Then obtaining medical and psychological care and taking preventing measures to avoid passing the virus on to others. Now, it's also their responsibility to see that they have suffered, but they should not give the virus to the other persons who comes in their life. So minimize stigma and discrimination. Now, how to minimize the stigma and the discrimination? Most important is join the social support groups. Okay, we always tell the patients, okay, who are suffering from HIV, join the support groups. We have a lot of organization, and in that organization, they give more knowledge about the illness and how to deal with simple problems. For example, they have some of the super added infections, okay, how to deal with them and what are the first initial symptoms so that they can take the medical intervention. Get to know more about others who are in the same situation. Okay, they should also feel that, okay, it's not only me who is suffering from HIV due to various reasons, but there are others also who suffer with HIV. Okay, so I'm not the only one. When you feel that you are not the only one, there are others, okay, and we are a group of people, then the social support is much better. Joining the group makes them realize that they are not alone. Otherwise, the feeling of loneliness comes to them. So if they have a support group, okay, that itself minimizes the stigma. And we have got Sati, okay, we have got various associations. I think individually in Gujarat also you may have a lot of institutions or organizations which cater to this type of patients, especially HIV positive, okay, women, children, maybe you will have separate. Here we have separate organization for the adults and for the children. Okay, so these are the areas where we can go and speak to them. Okay, we can alleviate their sufferings, we can alleviate their anxiety. So this is how the stigma can be reduced. Make them a part of the group, have a group discussions, so they feel that they are also a part of the group or a organization. And stand up to the stigma. Talk openly about HIV and stigma. Okay, even in the hospitals, whenever you have this type of specialty these days. Now these days have been created to create awareness and talk openly about HIV. Use supportive language. Do not put down anyone. Okay, that itself makes them to discriminate. What the health professionals, especially the way we talk to them, okay, be sensitive to their needs. Speak out to the correct myths and stereotypes, what is existing, so that we can correct their myths and tell them what are the facts. Educate yourself as well as the others. So as medical professionals or as nursing personnel, okay, we need to educate ourselves, and that education we can give to certain extent to the patients and their family members, so that they overcome their ignorance, okay, they overcome their fears, they overcome this, because there are various treatment modalities which can be suggested to them. So the first one is to overcome the stigma. So you see here, ignorance leads to fear, and because of the fear, people do not talk, they keep themselves silent, leads to death. But we need to fight up and act upon to overcome this all psychological problems of the patients. The second intervention, what we can give, or the tips we can give to the patient, is making treatment decisions. One simple way is asking what they have already knowing about or what they have already heard about it, okay, regarding the drugs, regarding the treatment, and build up upon them and give them more information. And also sharing experiences by other HIV patients. Okay, this is what one of the patient told me, ma'am, rather than only the other people speaking, if it is coming from the word of mouth of the persons who are suffering with AIDS, okay, that would be more helpful for us. So sharing the experiences of the friends and what they think about HIV drug treatment. Motivation to the drug adherence is one of the most important things, okay, that will help them to overcome the problems. The third one is love yourself first. That is what we need to tell to the HIV patients. Once they are diagnosed with HIV patient, they never bother about themselves because they are depressed. Okay, they have a lot of anxiety. But we should make them feel that they need to love themselves. Now, how to love them? Okay, yeah, that love and affection we need to explain to the family members to give to them if they are at home. If they are in our organization, it is shown in our attitude when we meet them, when we greet them, or when we talk to them. So family, close friends, or a support group is one of the first thing which can help them, okay, show love for themselves. And give reliable judgment. You know, there are some people who are very rash and harsh in talking. Okay, so give a reliable judgment for the people, okay, so that which is free support for the family members as well as to the this one. Whenever they come, have a talk, okay, listen to their problems, don't jump to a conclusion, and deserve to be loving in a supportive relationship. We tell the children also, yes, we know your father is suffering, okay, but he has these problems, but we need to accept this type of problems, accepting that you are a worthy, loved, and a respectful person. Every individual of HIV patient, whoever is there, we should have this type of respect for them. So then they will be able to love yourself. If they love themselves, if they have concern for themselves, I'm sure they will continue their treatment. Okay, they will do a lot of things for themselves, and they will see that they are overcoming the problems. So love yourself. That is for the HIV patients. Inculcate the feeling of love for themselves. Fourth one is find a purpose. Find a purpose to live. In depression and because of suicidal tendencies, okay, they forget that they need to live in this world. But let them find a purpose. And what is the purpose? Find time to serve others. Whenever you have an opportunity, okay, the HIV patients can be told, whenever you have an opportunity, see that you share your experiences. Wherever you have a forum, okay, share your experiences. In one of our celebrations, we had called 2-3 students, okay, who came and shared their experiences because they are in one of the association which is there for the HIV, and they were telling that their family members have disowned them, their close relatives have disowned them, but they are in an organization where they are looked after, and we feel that when we look at them, we never feel that they have HIV positive, but they feel that the organization has done a lot for themselves, and they have started to live with a purpose, and they say this is one of our way of um, giving back to the society, and that's why they are ready to go and tell to others what is their difficulties and what are their problems. So find time to serve others, and also they can share their talents, okay, whatever they are having the gifts. Some of the HIV patients I've seen, they are very, very talented, very, very much talented. So if they have talents, they can teach to the others who are having HIV positive, so that they can have a lot of you know um, feeling of love and affection by the others. The fifth one is, okay, if they are at home or if any organization, curb alcohol and drug abuse. See, the end of it is not to go into these things, because once you make a habit, okay, it's very difficult to come out of that. We understand that they have a lot of problems, psychological problems, and this is one of the easy means to overcome the psychological problems they feel. But the problem remains the same. Only thing, the person gets addicted to many of the problems. So addiction and HIV have a long, close relationship, and because of this, okay, it can reduce and the quality of life, as well as reduce their length of the lifespan. So we should tell the patients, okay, avoid alcohol as well as the drug abuse. The sixth one is maintaining a healthy lifestyle. If you see in this pic, we have got various activities which they can do. Okay, most important is have good nutrition. If they have good nutrition, I'm very sure super added infection or opportunistic infections will not be there. Okay, have good exercise. Walking is one of the best exercise. Okay, whichever is the exercise they are able to do, let them do. It keeps their mind also fresh and alert. Control of recreational substance abuse. You do recreation, but don't use any of the psychoactive substances for recreation purpose. And alterations in sexual risk behaviors. Okay, minimize all this or stop the sexual risk behaviors if they had any of the practices. See, these are all the things which we can do, and we can ask the patients, okay, HIV patients, to stick on to a very healthy lifestyle. If they have a healthy lifestyle, okay, they will be preoccupied. The psychological problems will be less, and the sleep and their other activities will be also improving. The seventh one is heed the bigger health picture. Always have a health picture in the mind. And how to have a health picture? If the patient wants to have a health picture, he has to have a regular health checkup, not to discontinue the medications, even if he has side effects, even if he has some complaint, even if he has super added infections. Okay, he should go for regular follow-up, and attention should be given to special symptoms if they have, and avoid and treat STDs if they have already STDs. Okay, that is sexually transmitted diseases. Okay, let them feel free to discuss with their doctor and the nursing staff and the others to keep away and get treated for all these things. So have a picture of health in the mind, always have a feeling that health is important for them. Once they get HIV, it is not all, but they can improve their quality of life. Yes, next one is how to manage the stress. I'm very sure as individuals they have a lot of stress. Okay, if they are even in the organization, at some point of time they always feel, I wish my family was there. Okay, that thought comes to always to their mind. But their situation has predisposed them. Even at home, they may not get that much of love and affection. But how to manage the stress levels? Okay, if they have a lot of stress, okay, the viral load and the CDC level count will definitely be influenced because of the stress. Now, to gain all these things, what are the things which they can do for stress? Okay, to reduce the stress. One of the best means is to practice yoga. Okay, have at least one half an hour yoga time for themselves. Okay, especially the patient. And suppose we go to any of the organizations, okay, we can teach simple activities or the exercises for them, how they can, okay, improve their mental health. Sitting and discussing their problems with others, okay, it can be friends, it can be their family members, or it can be their organizational inmates. They can also speak to health professionals, whoever are there. Okay, you have counselors, you have people who have coming for visit there. There may be outside doctors who can, okay, feel free to speak to them. Yeah, this is one of the studies have been done on AIDS. Okay, how can they spend time with the pets? Also control your emotions. Okay, especially anger. Okay, you have thoughts of committing suicide, you have thoughts of alienation. Okay, control the emotions. And always have some friends who can help you, even in the organization or at home. Okay, you have some neighboring friends, take them into confidence, okay, so that they can help you. Gardening is another good exercise for the mind, okay, which helps you to relax yourself. And de-stress activity, you can have walking exercise. Suppose you don't want to feel discriminated or this one, in your own place inside the house you can walk. You can walk outside your house. If not, you are not willing to go far away, at least you have a exercise. Don't sit at one place and think. Thinking doesn't help us in any way. We go into more of mental illness and more of the psychological problem. So these are all the ways how we can reduce the mental stress, okay, or stress management. The next one is get nutrition, that is the right kind and the right type. These are two important things we should know. We may eat, but then that must be good for our illness. That is the right kind and the right type. So we need to manage the weight. You have to check whether you are losing the weight because of the infection. Then strong. Now once you have good food, definitely your immune system and the resilience will be better. Okay, both to the bones as well as to the heart. You will have extra energy levels, okay, to do your activities, do yoga. You feel free, okay, you feel energetic, and also it reduces the inflammation. So make the patients to concentrate, okay, and take good nutrition. If you advise them to go in for good nutrition, I'm very sure these are all the activities which they will be able to do. The 10th one is family support and rehabilitation programs. We have hospital-based rehabilitation programs, okay, in the individually. In the community also we have special organizations for the HIV patients. We have support group meetings. We have psychotherapy sessions. We have education and training, interaction with industries, livelihood options. Suppose the person is in an organization or is at home, and he doesn't want to go to his previous workplace, but we can help him how he can manage his livelihood. Okay, make him to change his job, okay, or inculcate in him some of the things. We had a lady who was very good in tailoring. Okay, so we made her, we have seen that our NGOs have given her a machine, okay, sewing machine, and she started to do the stitching. And she could support her family with her small income which was there. So these are the different ways which can be there. It can be vocational rehabilitation and it can be family centered rehabilitation. We can also see how we can best place the children, okay, help them in the education. So family support and rehabilitation program. These are the 10 tips which you as a nursing person or a nursing student or maybe as a healthcare professionals can give to the persons who are having psychological problems. So these are my references. If you have any doubts or any questions or any queries or you want to add anything, you are most welcome. Thank you for the session.
Thank you, ma'am, for the informative sessions. We have some questions up here.
Yes, yes.
Ma'am, the first question is like HIV and depression are associated. Like people with HIV or AIDS may fall into depression.
Yes,
And depression has a risk of suicide associated with it. So when a person is suffering from both HIV and depression, what should be given the priority to deal with?
No, actually, the person should be first treated for HIV. Okay, and at the same time, we need to give a cross consultation to the psychiatrist. Okay, so both the treatments will be going on for the patient. So once the person is diagnosed and he is on this treatment, okay, he also needs to be referred if he is having this one suicidal ideas, because if he is having suicidal ideas, he cannot be kept at home because there can be a risk for suicide at home, but hospitalization would be much better for him so that we can prevent the suicidal tendencies at home, because at home we need to be